So hello, I am Dr. Hayes, Whitney Veterinary Hospital veterinarian, and today I'm going to explain to you a little of the anatomy involved in a TPLO or tibial plateau leveling osteotomy. This is a surgery that's done to correct cruciate ligament tears, which is probably one of the most common injuries in dogs. So this is a model of a leg, and this is the upper leg bone of the thigh, the femur, and the lower leg bone, the tibia. And as we look at this is how our dogs are standing. We have inside of here some ligaments that are crossing each other called the cruciate ligaments. So when we look at this, we have a front one called the cranial cruciate ligament and a back one. We also have inside of the knee some cartilage, that's these, and those are called the meniscal cartilages, and they're basically the shock absorber of the knee. So they give cushion when the dog is standing or jumping on it. When the cranial cruciate is intact and dogs are standing, they typically stand somewhat like this, and the top of the tibia, the tibial plateau, actually slopes backwards and to the ground. So their tail is over here and they're standing kind of on a hill, if you will. The cruciate's job is to keep this femur up top. And if it fails, then what happens is the femur, every time we step down, slides backwards like that. Okay, so there are lots of ways to fix knees, but bigger dogs especially, but dogs that have a decent amount of slope on the top of their tibia are more likely candidates for what we call the plateau leveling osteotomy. So I like to think of it like standing, your car is on a hill and your parking brake is your cruciate. And if it tears, then we have an option of trying to replace the parking brake, which does not work very well in larger dogs, or start parking our car on top of the hill. So what that looks like, I will switch models, is we go into the knee on the inside of the leg, so medial aspect, and we're actually going to cut the bone using a mathematical formula and turn it or rotate the piece at the top from being slopey to flat with the ground. At that point, we plate it back together and we have a stable knee. No longer does the femur slide backwards because they're now standing on the surface. As far as the plating goes, the plates are put in and they stay permanently. This equation is calculated off of x-rays, and pretty much from there, as far as recovery and rehabilitation and actual surgical procedures, that's based on an individual patient. If you have any questions, you can give us a call at 309-685-4707.